I'm Dr. David Klug. I'm asking for your support for the Emergency Services Directory. There are many services which play an important role during an emergency. These include 911, police, fire and ambulance services, hospital emergency departments, specialty services, and supporting organizations. It is important to react quickly to emergency situations to save lives, to decrease the time of convalescence and permanent disability. This is especially important in rural areas. The directory was developed in 1993 as a 2-county, annually printed single reference source. All these services are listed, plus the list of area physicians and the hospitals to which they prefer the ambulance take their patients. The directory website was developed in 2003. It now contains information of over 4,700 emergency organizations, including most emergency information in the 62 counties in New York State. Here are some people who appreciate what this directory provides.
My name is Steve Erb. I've been a firefighter for almost 35 years, both as a career firefighter and a volunteer in my community. The mission of the men and women of today's fire service is the same today as it was in the past, to provide rapid and safe response to calls for help. The traditional role was to fight fires, protect property, and save lives. This role has expanded to include responses to motor vehicle crashes, rescues from structural collapse, chemical and biological hazards, and terrorism. Planning, preparation, and ongoing training are among our essential goals. The Emergency Services Directory provides easy, rapid, and accurate information that helps us to achieve these goals. The Emergency Services Directory will benefit the fire service by providing information regarding our partner agencies' capabilities, contact personnel, and professional affiliations. It's a source of data for budgets and planning, and most importantly, it will help us be successful in achieving our goal to protect property and to save lives.
My name is Karen Dewar. I'm the Director of Emergency Medical Services for Livingston County. I've been an EMS provider for 35 years and have used the Emergency Services Directory many times, both as a leader and as a provider. As a provider, the directory can be an invaluable resource when looking for services to refer patients to, be it social services, elder care agencies, physician offices, or any other emergent medical needs that they may have. As a leader, I've used the directory to network with other agencies. Networking and finding the numbers of the people that you need to contact as a leader is a very important part of a management position. Having physician information available when in the field, either the contact numbers for the physician offices, the hospitals they're affiliated with, or the services that hospitals or physicians provide, is important for an EMT on the street to determine the appropriate destination for their patient. The Emergency Services Directory is invaluable. It's easy to use, it's easily accessible, the information is right at your fingertips, especially in situations where you may need it at a critical time.
Hello, I'm Arthur Jones, Coordinator of Initiatives for Rural Health Community Systems Incorporated, a rural health network working with our rural EMS providers in Steuben County, the ambulance services and first response agencies. I'm also a paramedic with 39 years of field experience in emergency medical services. I wanted to comment on the Emergency Services Directory. I do feel it is a valuable tool for our emergency service providers. It contributes to increasing cooperation both internally and externally for the rural agencies and the general public. It makes them accessible to the general public, and it aids in recruitment of new members. It's a tool that I think is worthwhile, has proven its worth, and I think still has more value to be determined. So I do endorse the to the directory, and would like to see it continue to grow. Thank you.
Hello, I'm Dr. Bruce Thompson, an emergency physician at Unity Hospital in Rochester, New York. And I'm also the pre-hospital director for the Unity Health System. I've been using the Emergency Services Directory for years and found it especially beneficial in terms of talking with my ambulance colleagues and knowing where my contact people are in those agencies. I want them also to know about us. As a community hospital, we have stroke centers here. We can do percutaneous cardiac intervention, and that's important to us for them to know. I also want to know from them if they have specialty care, such as bariatric stretchers that we could use. I'm also on the emergency management team. And in the emergency management team, I brought up the Emergency Services Directory years ago so we could plan for disasters. I showed them where we could get extra resources in case we needed mutual aid, where we could get shelters, where we could have buses, we could have transport agencies to help us in case of a disaster. And recently I went to an emergency management conference hosted by New York State, where one of the speakers talked about the different problems we'd had with hurricanes coming up through New York and with the tornado in Joplin, and how the people responded to that and where there were real problems. I showed him what we've already done in our region with the Emergency Services Directory. I just opened up my iPad and pulled it up and showed it to him. And again, he was very impressed and is thinking about taking that back to Albany, use things similar to this. And we want to expand. I've been very happy with the way that the Emergency Services Directory continually updates itself and improves itself and makes better functionality for everyone. Thank you.
For 20 years now, the Emergency Services Directory has been an important resource for fire departments, ambulance services, rural health networks, and hospital emergency departments. As you've just heard from those involved, this tool helps provide quick and effective emergency care. As a nonprofit entity, STEP, the Society for Total Emergency Programs, depends upon donations and sponsors to maintain this website service. STEP provides every organization listed a free printed copy of the directory. You can be a part of saving lives. Please support this vital community resource. Thank you.